Good evening. I would like to welcome you to tonight's virtual program, Nordlys Advanced Clinical Training. If you have questions during today's event, please enter them in the Q&A box. We will answer as we go along. We will be offering a certificate of attendance. You must be in attendance for at least 50 minutes of this program to be eligible. To obtain your certificate, you will click on the certificate icon button at the bottom of your screen towards the end of tonight's program. If you need to download your certificate after the program has concluded, please allow 24 hours. The information and photographs contained in this presentation are the property of Candela and its consulting healthcare providers and are provided for educational and discussion purposes only. By sharing this information, neither Candela nor any of its consulting providers give you the right to use the information presented. By participating in this webinar, you agree not to photograph, reproduce, or distribute any of the information or photographs presented during the webinar. With that, I am very pleased to introduce Dr. Konika Schallen, Senior Vice President of Clinical Operations and Medical Director at Candela.
Thank you very much, Grace. And on behalf of everyone at Candela, we'd love to welcome our audience here this evening. We're going to talk about Nordlys and its applications. And one of the things that we really love to do here at Candela is bring you education from our users because they're really the ones who are out there perfecting protocols, really seeing things with their patients on a day-to-day basis. And we love to bring those best practices back and share them all with you. Tonight, we have Meghan Murphy, that many of you may know, who is very, very experienced and for many, many years has been with us at Candela as our research nurse at the Candela Institute for Excellence in the past, and now as well in her practice. And she has a vast experience with multiple different devices. And we're very excited, especially this evening, to have a special guest, and that's Hady Hamade, who is joining us from Canada, from our friends north of the border, and he's the director and is also the laserologist, which I think is fantastic, at Skincare and Laser Clinic in Ontario, Canada, and really looking forward to sharing with you what both of these fantastic users have to say about Nordlys. Just advancing us here. Thank you. And I'll leave it to Meghan.
Hi, everyone. Thank you, Dr. Schallen. So today we're going to review the Nordlys, which is actually one of my all-time favorite systems that I've really ever used in my career. It is a little bit of a different platform due to one of the best benefits of the platform is its selective waveband technology. And so what that means is when you're referring to intense pulse light, you either have narrow band intense pulse light or you have something called broadband intense pulse light. And with narrow band intense pulse light or narrow band IPL, it allows you to really use wavelengths that are highly absorbed by either melanin, hemoglobin, or water. So it makes it very effective in the treatment of pigmentation, vascularity, and even hair removal. And it's something that I find when I had to use a broadband IPL, I really didn't understand the full value of the SWT technology until I was using a different system. So just something to note there. You also have your 1550, which is a fractional non-ablative laser for deep skin resurfacing. So when we say non-ablative, we are referring to the fact that the technology does not disrupt the, in theory, does not disrupt the stratum corneum, but you're still able to work on the tissue underneath the surface of the skin. You also have your 1940, which is going to target the more superficial layer of the skin, so closer to the epidermis. And it is intended for skin resurfacing and treatment of benign pigmented lesions. And then you have your 1064 nanometer handpiece, which is your true laser handpiece, which can be used for vascularity, nail, and wart treatment. The 1550, the 1940, and the 1064 nanometer handpieces are actually your laser handpieces versus your SWT handpieces. And then it does have 22 FDA cleared indications. I know just through my work with Dr. Schallen uses this quite frequently in her practice. And Hady, I believe you do as well, correct?
Yes.
Yes. Okay. And one reason that I like it is because anything I come across, like any patient I see, anything typically, I feel like I can pretty much successfully treat with the Nordlys. Do you agree with that, Dr. Schallen and Hady?
1,000%.
100%. 90% of the indications that present here in my clinic, I basically treat them with the Nordlys due to its many FDA cleared indications and its versatility.
Perfect. And so now when we're talking about the Nordlys SWT wave bands, essentially what this means is it filters out any unnecessary light, especially in the water absorbing part of the spectrum. So instead of your energy having to cover the full spectrum, let's say from 400 nanometers to 1200 nanometers, we're going to be able to cut some of the unnecessary wavelengths at the shallower end of the spectrum and then at the longer end of the spectrum. So because of that, you find that you have lower risk to the patient. There's less bulk heating happening, and you're getting a more efficient energy delivery. So what I find from my experience, I've had experience with quite a few broadband IPLs. So if I was using a setting on the broadband IPL, let's just say for individual vessels, I was doing 25 joules, 30 milliseconds. With the Nordlys, I typically can get away with doing 10 joules, 10 milliseconds, or even 13 joules, 13 milliseconds, that kind of thing. So you're using about half the energy that you would with other systems. So you, in my clinical experience, just speaking on behalf of myself, I found much less risk of things like, blisters or things like that. So I also, interestingly enough, a lot of times when I was using the broadband IPL, I would start to see cases where I think I exacerbated underlying dermal pigmentation. And so it did start to make me a little bit nervous. I think a lot of what we see clinically sometimes is not always a clear-cut clinical presentation of just epidermal pigmentation. I do believe that there are quite a few patients that you'll see in your practice who have underlying dermal pigmentation. And so what I found is with the less water absorbing wavelengths of the Nordlys, there was less bulk heating, which therefore, in my clinical opinion, decreased the risk of exacerbating heat inducing clinical presentations. Hady, have you experienced that as well in your practice? Because I'm sure you see quite a bit of epidermal dermal pigmentation.
Definitely. So for patients with melasma, for example, I wouldn't be concerned to treating cases with melasma and rosacea, for example, because with the Nordlys SWT, it doesn't cause bulk heating because the cutoff point is 950 nanometers. Anything beyond that starts to target water, causing bulk heating. And with any dermal pigment, this can actually activate melasma or any dermal pigment, which can worsen this case. So for patients presenting with melasma and rosacea, I wouldn't be concerned to treating them with the PR530, for example, not worrying about exacerbating their melasma in that case.
And Dr. Schallen,
yeah, go ahead.
No, I was just thinking, because you're seeing quite a different clientele than I know what I see, for example, because you are in Florida, so you're seeing quite a few darker skin types. So you probably, not only are you seeing dermal pigmentation, you're also constantly thinking about the risk to the patient.
Absolutely. We see a lot of sun and dermal pigmentation. And what you both bring up is really very valid. You really hit the nail on the head, Meghan, when you talked about how you need 50% less fluence, because when you are the opposite of broadband light, SWT is selective, not broad. And it's selective to the chromophore. It's selective to what you're trying to get to. So whether it's the red using the PR, whether it's the brown for the melanin using the PR or the VL, you're going for whatever it is you're going for, and not all of that excess energy that can, as you both said, stimulate that dermal pigmentation or melasma. That's why, intense pulse light gets a bad rap. And it is true. You have to be very careful. You can't just, melasma is a complicated thing to treat, but you have to make sure you're cooling the patient, and the pre and post is important, of course. But this is so much safer because you're really, really delivering much fluence. And forgetting about that particular issue, or that particular problem in patient's skin, forgetting about melasma, but talking about other things. In general, you always want to be able to treat your condition with the least energy that you can possibly use. And so that's a really important point, and I think that's something that can't be underlined enough. So thanks for bringing that up.
Thank you for your input, both. Okay, so the other thing, the reason that so when I was doing the original, we were using this system in the clinic. One day, instead of using the default setting, and with the default setting, you're usually going to get kind of a split pulse setting, and you'll see that on the system. And one interesting thing about the Nordlys is you are able to customize your pulses. So you can actually control the pulse time or how long the energy is on the tissue for. You can control the delay and the number and sequence if you really wanted to. I don't really customize it to that extent. I kind of just use the individual pulse setting quite frequently. So you can use that as well. And then the other thing that's really important, and I see this a lot in the New England area, a lot of my patients have underlying redness, right? So they have kind of this flushing in their skin. You can see it if they're exercising or what have you. And that really needs a very short pulse duration in my clinical experience in order to treat it. So I actually default to 1.5 or 0.5 milliseconds. And so I find that for resistant pigment and this kind of difficult flushing that can be, relatively difficult to treat, you really need the low pulse duration that the Nordlys offers. And that's actually a very unique feature to this IPL or SWT in general. And then you can use, if let's say you have a patient, and I don't love bruising people. I think Dr. Schallen, you don't seem, Dr. Schallen's very used to bruising people. I get nervous. And so I try to not bruise, but really there is some clinical thought or especially with Dr. Schallen, who's quite the expert, that it's okay to bruise people with rosacea, but you can avoid that if you want to.
Yeah, and we don't, sometimes you try to walk the line as close as you possibly can to a subpurpuric treatment. Every once in a while, there are some things that do require purpura, but in general, I think that, you have good clearance with purpura, but sometimes you have some residual hemosiderin staining with purpura, and especially if you're exposed to UV light afterwards. So you're right. You don't want to necessarily always have a bruising or purpuric treatment, but certainly the thing to highlight, I think, with Nordlys, and what a lot of experts that treat even port wine stains with Nordlys use it in addition to their pulse dye laser, their V-beam, because there is some benefit to using the very short sub-millisecond pulse durations that no other intense pulse light system has. So this is just a very different type of system, and that short pulse duration makes a big difference. Even if you're not treating some of those specialized things, it really helps in something as commonly treated as rosacea.
And then Dr. Schallen, we have a question here, which I think is a little bit, so from Ashley, thank you. You mentioned it does not disrupt melasma. Is it suggested to use the PR to improve it over the peak away? What are your clinical thoughts there?
Yeah, so I want to be very clear here that melasma is it's multifactorial, and there's multimodal ways to treat it. And it's very important that the patient's on a holistic regimen of the right types of topicals and medications and the right type of post-treatment care. It's very important to avoid inflammation and avoid excess heat. And that's why Peak Away, which is FDA cleared to treat melasma, is a favorite because of most of the energy delivery is photoacoustic, which it's not requiring heat delivery to the skin. So I think that Peak Away is extremely good and extremely safe in treating melasma. What we're trying to say here is that if you have a patient with melasma, many of our practitioners have had success, and you have much less of a likelihood of exacerbating melasma. What I do treat patients with melasma with this device. It is not FDA cleared for that, but that's a personal preference that I've learned from around the world with many other users of Nordlys, and I try to use the VL setting in general. But it depends on the skin type, and we know that there's underlying vasculature in much of melasma, and so trying to go ahead and coagulate that vasculature with the mildest settings possible and the least energy possible is one of the ways that you may utilize this device.
Right. And then as a follow-up, it just says how you would feel okay to treat laser hair removal over melasma, like on the upper lip. I personally would be okay with that, but I would use something to cool the skin aggressively post, and in some cases, maybe even a little bit of a topical steroid just to decrease the exacerbation of inflammation. Do you have anything to add to that, Hady or Dr. Schallen?
Yeah, and I would just say that be very careful. It depends on your wavelength, depends on the skin type, it depends on multiple things. So there's no blanket yes or no on that one. Hady, what do you think?
I definitely agree with you. For my patients, I would definitely treat their upper lip, even if they have melasma on their upper lip. I would definitely go for the mildest settings possible. In order to avoid inflammation, I would definitely cool the area after the treatment. And possibly if I see a little bit of erythema, I would apply topical steroids in order, just in case, not to exacerbate it.
Yeah, mid-potency to high-potency steroids topically for 3 to 5 days post-treatment twice a day is important if you're treating those areas. So be careful for sure.
I totally agree.
Thank you, Dr. So another unique feature of the Nordlys is that there is water within the SWT applicators. So there's another layer of added skin protection. And so basically, as the water is filtering through the handpiece, it's going to remove some of that bulk heating from the skin. So again, it's just a nice added feature. It's going to decrease the risk of burns, hypo or hyperpigmentation, and scarring. And the reason for that is as it's cooling the epidermis, it will therefore decrease the risk of high temperature changes in the epidermis. So it's very interesting. It's another interesting feature of the Nordlys that you don't need an external skin cooler. So I do believe in clinical practice, am able to see sometimes even a stronger clinical endpoint because of the way the water is filtered. So just something to note there. So these are all the different applicators that are available on the system. You can do hair removal for dark skin types, hair removal for standard. You can use large area hair removal applicator. You have your skin rejuvenation handpiece, which is your vascular lesions. This handpiece is what we would refer to as the VL555. With this handpiece, it offers wavelengths from 555 to 950 nanometers, so a little bit less absorbed by melanin than, let's say, our 530 applicator. So you're going to use your VL555 typically on darker skin types. I will also use it if I'm treating off face, just because when you're treating off face, the pigmentation, it's a little bit less aggressive of an energy delivery. And the other thing to note is when I was using the device recently, I didn't have access to the PR530, and I was actually able to effectively use the VL555 to clear vessels, and I was very impressed. So very cool feature of that. You also have your PR530, which is 530 to 750 nanometers. So that's going to be a little bit more absorbed by melanin, but it is going to be a little bit easier to use, I think, on the lighter skin types when you're seeing kind of that really red flushing or those individual telangiectasias. And then you do have the PL handpiece. I really only used this once, and it was on a dermatology nurse practitioner who was on multiple layers of skincare. We had done quite a few treatments. She had a little bit of light resistant pigment, but it's one of my favorite handpieces, but you just have to be very cognizant of the fact that it is highly absorbed by melanin. So just something to use with caution. And really, I only used it in a resistant case. Dr. Schallen, do you use that handpiece very frequently?
Hady?
I have used it multiple times, especially as you mentioned for the resistant lesions. I had a case where she had all the solar lentiginous on her shoulder and back due to excessive sun exposure. I did isolate the area with a wet gauze and treated each and every single solar lentigo. with the PL. It is a little bit aggressive, so you have to be really cautious with it. But I do think that it yields amazing results just from one session.
I'd agree. I think that you hit the nail on the head too, by isolating the lesion, because that 400 nanometer bottom cutoff filter, the bottom cutoff there is really, really highly absorbed by melanin. So excellent for those lighter lesions for sure. But you want to make sure that you're not getting the melanin around the lesions. Great, great applicator.
And then you have your 1064 nanometer, which is indicated for the treatment of leg veins, vascular lesions. So I would think of those as more those individual thicker vessels that you see, onychomycosis. And then two hand pieces that I really truly adore are the 1550 and the 1940. The 1940 I pretty much use on any patient I possibly can, especially when you're kind of treating things that may present as a little bit atypical. So let's say dermal epidermal pigmentation, or maybe sometimes in some cases, although it's not indicated for this, PIH, things like that. I really love the 1940, and I personally love the 1550 for deeper deeper textural irregularities. Dr. Schallen, do you consider that as well? And Hady, I think you both probably, from what I've seen, you both use those quite frequently.
Mm-hmm. Mm-hmm.
Yeah.
Hady, how about you?
My personal favorite would be the 1550 for acne scars, skin texture, dilated pores, fine lines and wrinkles. It just provides a beautiful, youthful effect on the face. And with the 1940, it works perfectly on benign pigmented lesions. It just gives the overall Instagram filter look for all my patients. I think both these handpieces, the 1550 and the 1940, are phenomenal. And they do have, from a business perspective, it has a high ROI.
Mm-hmm.
Interesting. Thank you for that. Okay, so now we're going to review some clinical cases. So this is my patient. She's actually my hairstylist, and I had been trying to get her in my chair forever because she really has, it's really a very difficult case of acne. It's exacerbated by the fact that she does tend to wear kind of heavy makeup. And then she didn't really want to go down the oral retinoid route. So we did 1550 with the PR 530, and her results were really, really impressive with that. The entire time that she was in the treatment, she did not have a single cystic acne breakout, and you can see how much clearer her skin is. One thing that does tend to happen is we were getting closer to the summer, and when she was wearing her zinc containing SPF, it definitely would increase some of this acne. But you can see that and we were really, really happy with the results. One thing that I loved, she had a lot of, not only did she have cystic acne in the beginning, she also had quite a bit of post-inflammatory hyperpigmentation, or PIH. And so I find that the 1940 does a really nice job on that. So just some food for thought. This is somebody that if it was not in the clinic, so this was in the corporate clinic at Candela, so we typically try to just stick to laser when we're treating these patients. I would like them to be on something like a clearing serum and or a topical retinoid. So just some food for thought with that. She was very, very happy with the setting, with the treatment. She texted me saying she couldn't believe how amazing her skin looked. And really the fact that she didn't have a cystic acne breakout the entire time was pretty impressive. I will say I used higher energies on the 1550 in the hope that I would get deep enough to actually damage some of the sebaceous glands. And what we know about the sebaceous glands is they're pretty deep in the dermis. So by using a higher energy setting, I was getting a little bit deeper into the skin. And then with the PR 530, so what I did is I used the PR 530 first. I used it on a short pulse duration because when you press on her acne marks, they actually would blanch. So they would like kind of turn white and then the blood would flow back into them. So because of that, I knew that there was some increased vascularity in there, but I knew that that increased vascularity was related to really small vessels. So I used a short pulse duration. I did 1.56 joules on the PR 530. And then I would do the Frax 1550 and, you know, I was pretty high. I was at 50 millijoules, which is pretty strong with a 12 millimeter scan width. And then I would do the 1940 over that. So I would do 2 passes with the 1550, 12 millimeters, 50 millijoules. Then I would do 2 passes with the 1940. I go right to 12 millimeters, 20 MTZs. And so you can see here she had quite a nice setting. Now, one thing I want to know, and Hady, I think you've used this quite a bit in your practice for acne as well, is I do think it's definitely something that you have to maintain. It's not like you're going to do 3 sessions and never have an acne breakout again. Do you agree with that, Hady?
Yes, absolutely brilliant. I think this result is phenomenal, and I definitely agree. How I would approach this patient, exactly how you mentioned, I would definitely press on her acne to see if it blanches, just in order to pick and choose whatever parameters I should pick for that patient. How I would approach it, I would do 1 pass of the default setting with the split pulse, and then I would perform another pass with the 1.5 millisecond short pulse duration. And I believe that those 2 passes, they're really, really effective for cases like that. And then one thing that I would do extra, I would stretch out her skin, see if she has any whiteheads underneath the skin. If she does, I would perform extraction. If not, I would go ahead and perform the Frax 1550. And that definitely helps a lot with the current acne and, of course, the acne scarring.
Okay. That's a good point. And then we have a question here from Jessica. Thank you, Jessica. Which PR530 settings did you use? Did you use the rosacea setting or photo rejuvenation setting? So I actually didn't use either of those. I'm a little bit different than some in that I typically tend to default directly to the individual telangiectasia setting, and then I press the red or the pink little circle, which is going to give me the shortest pulse duration when I feel that it's appropriate. I do think Hady has a good point. I probably would like to try that in the next round. Is I would try to do the split pulse duration first, then the single pulse duration, just to see if would I get even much more of an effective outcome just because of the second pass and, you know, optimizing the parameters, I guess is what I'm trying to say. So that's a bit of an interesting point. And as a nurse, I tend to not be very good at extracting, but if I was, I would do that because that makes a lot of sense. And you can even see, since I've seen her, you can see how the makeup is causing a lot of those whiteheads and things like that.
I totally agree. I want to emphasize on the importance of the absence of whiteheads before performing the Frax, because I feel like when I go on high energies with the Frax 1550, whether it's 40 or 50, and she has underlying whiteheads, I feel like the patients would flare up in acne. It's all due to those whiteheads being flared up afterwards. So that's why I would perform extractions in order to prevent that from occurring.
That's a really valid point. And so what you'll see sometimes in clinical practice when you're doing these patients, or really sometimes you'll have a patient who has an acne flare that typically isn't even prone to acne, but there's a lot of inflammation sitting right on the sebaceous gland. So the bacteria can't be expunged. And so what ends up happening is you'll kind of see that acne breakout post. And no, Allie, I did not use the acne setting. And then what I did for the treatment was the PR5, this was all same day. So PR530 first, then 1550, then 1940. Interestingly enough, if you look closely at her forehead, she does have a little bit of dermal pigmentation there. So I believe that I actually did the VL555 up there, and then I did the 1940 at a very low density. So I only did like 1 or 2 passes there, and then I cooled that area up there. So just something to note, I kind of will tailor it to what I see.
And Allie, so you mentioned the acne setting, but you mentioned the acne setting, but Hady, I think you remarked that you'd use the photo rejuvenation setting first and then the rosacea setting. And I just wanted to point out that acne setting is similar to the photo rejuvenation setting. So it's a similar split pulse and you'll get the similar starting energies. So you could certainly start with the acne setting do the acne setting in a single pass, see how the skin is doing, and then go ahead and do a shorter pulse duration to get those finer vessels, the way Meghan did. So, yeah, I'm sorry, the way that Hady talked about doing one longer pulse, split pulse, and then the shorter pulse, single pulse. Does that make sense? I guess you're not going to tell us, but.
Yeah.
No, that does. Sometimes I wish we could just have the device say like split
Have
pulse.
everybody up, right?
That's a whole other story. Okay, so this is actually one of an outside case. This is from Dr. Heftick. Thank you very much. So this is a presentation of a 40-year-old female patient. She presents with erythematolengitactic rosacea. And so basically what you'll see is pronounced and persistent central facial erythema, meaning you're seeing a lot of redness in the center of the face, primarily affecting the nose and cheeks, and it's accompanied by skin sensitivity. What I have learned, and Dr. Schallen, I owe this to you, when you're treating somebody with rosacea and they have kind of the acne flare-up component of that, you do have to consider that it is most likely that their barrier is damaged. So when you're doing these treatments, you want to make sure that you're treating it with care and that so I made the mistake in my clinical practice of I had a patient who had a severe rosacea flare and she also had the acne breakouts. So in my head, I was like, I'm going to treat this with the PR 530 and do a little bit of Frax 1550 over it to try to damage some of the sebaceous glands. But basically what I think was happening was her barrier was so disrupted that when I was doing the 1550, I was a little bit aggravating some of that. So I think it's really important to make sure they're on appropriate skincare. What we since realized, and I don't know, do you do this standardly with your rosacea patients, Hady and Dr. Schallen? It's like I guess what I'm trying to say is it's very important. Not only are you using the PR 530, but that they're also on some really good moisturizer or something like that if they have a disrupted barrier.
Yeah, I agree. I think that holistically. Sorry, Hady, go ahead.
Yeah, I definitely think that the skincare routine should be optimal within her case. All of the products that she should be using, we have to review it, and we have to ensure that all her skincare products are suitable for sensitive and reactive skin types, which will definitely aid with better outcome.
Thank you. Okay, so the other thing to be really, and I did this in my clinical practice, I actually made a cheat sheet for patients undergoing rosacea treatments that really educates on, how the different environmental factors can affect this. Because let's just say, I actually, when I was working in the clinic doing one of the clinical trials, I had the most amazing results on this patient. Her vessels cleared, her redness cleared, and then at the follow-up, everything had kind of come back. And so I asked Dr. Schallen about it. And the only thing that the patient had changed was that they had a back injury and they had started taking high doses of an NSAID, which thinned the blood. And so what Dr. Schallen explained to me was because she was taking this high dose blood thinner, the blood was able to get back into those capillaries and redilate. So little things like that, you really want to educate the patient on, because unfortunately with rosacea, there's a lot of environmental factors that you have to try to minimize or control. And so with Dr. Heftick's case, she had also tried topical metronidazole gel and anti-redness dermocosmeceuticals, which yielded minimal improvement. So what she did was 3 Nordlys treatments at 4-week intervals. In the initial treatment, she used the PR 530 handpiece, starting with default settings for rosacea. So she went to the screen and highlighted rosacea. And then she also would do facial telangiectasia settings. She then, in subsequent sessions, went to the sub-millisecond pulses. So I believe what is most likely what happened is in subsequent sessions, she went to the individual telangiectasia setting and then pressed the little red circle down at the bottom right. And she used that treatment. She would cool in between passes to help aid in comfort. And then during the final treatment, she used the 1064 nanometer handpiece around the nose to target those individual resistant telangiectasias. And then one thing that I always love about this is you're going to see their erythema and edema start to really lessen within 24 to 48 hours post-treatment. One thing to note, and this did happen to me recently when I used the VL555, if they have thicker vessels, there is a potential that the vessels will actually darken. So they'll darken, but when you press on them, they're no longer blanching. That means you've effectively coagulated them, but the body needs to clear that out. So do tell your patients that can be expected. And then she had the patient use regenerative cream for 5 to 7 days, followed by sunscreen use. And you can see here, like, I would say that this is somewhat of a more difficult case. Like, I don't think I would, if I was in a practice that had only a broadband IPL system, I don't necessarily think I'd see the results that I wanted. So that's really important to note here. So you can see the settings here on the screen, which are great. And so you can see here how she did the first setting. She did the first time she did the individual settings, and then she did the double pulse rosacea, and then the single pulse rosacea. So just something to note here. Another thing that's really nice about the system is because of the less risk of bulk heating, you're not using a lot of water absorbing wavelengths. You do have you can kind of do subsequent passes pretty nicely. Allie asked, how many passes do you recommend with the PR530 for rosacea? I think it really depends on the case. If I see somebody with a lot of persistent erythema, I tend to use the shorter pulse duration first and then go after the individual vessels after that, just because I don't want the patient to have a lot of erythema and then I hit them with the short pulse duration and I increase the risk of bruising. But I've definitely done anywhere from 1 to 3 passes. But again, I only did that once I had been using the system. I think I had treated like 50 patients with just doing a single pass until I felt comfortable doing double passes. Hady, do you agree with that? How many passes would you typically do?
I definitely agree. I would start off with a single pass for the first session. But then when I feel like the case is starting to become a little bit stubborn and resistant, I would definitely do 2 passes with 2 different parameters. I would start off with the split pulse settings, which is the rosacea standard settings. And then afterwards, within the same session, I would perform the short pulse duration settings. And then if she had stranded telangiectasias here and there, I would target them with the NDIAG also within the same session.
And Dr. Schallen, how would you approach?
Yeah, no, I agree. And one of the things I want to point out is that with the rosacea setting here, where it says 7.4 joules in the treatment protocol in the first treatment, the pulse duration, it's really split pulse, and so we're not double pulsing on the lesion. It's just that the 7.4 joules per centimeter squared is split into 2 subpulses so that the skin has some time to rest. It's okay to do a double pass if at the end of the treatment you feel that the patient's skin can accommodate a second pass, but it's a really good idea with somebody really as erythematous as this patient is on the left. If you're just, haven't done all those cases, leave it alone after 1 pass, and like you said, Megan, be really careful about that second pass. The second pass can be a really good thing, as long as the skin is able to accommodate. You have conversion of oxyhemoglobin to methemoglobin. You're going to have additional absorption of a secondary target. That's fantastic, but you don't want to overdo the heat as well. So this is a really interesting case, and it also highlights the submillisecond potential of this device. But notice how low the fluence is with that submillisecond potential, especially on the second pass. So this is, I don't think that you can obtain this kind of result with any other intense pulse light treatment, because you don't have those short pulse durations anywhere else. It's really fantastic, and Dr. Yeftik did a fantastic job over there in Serbia.
Thank you. And just with the double pulse, as Dr. Schallen explained, it's not really a double pulse. It's taking the 7.4 joules, delivering half with typically a 10 millisecond delay, and then the other half. So we will addend that to say a split pulse versus double. So Hady, I think we are going to your cases next.
Okay. And I'm so glad that you have mentioned the case that you encountered with papules and pustules And basically it would be subtype 2 papulopustular rosacea, because this beautiful case is really, really interesting. And I also want to highlight on the importance of the submillisecond, because this patient had this case, had this rosacea flare up ever since she was 18 years old, and now she's 27 years old. She has literally tried many types of lasers, including an IPL. I'm not sure what the brand, she was not sure either, but I'm pretty sure it's not as unique as the Nordlys, and it doesn't have the submillisecond as the Nordlys. So when this patient presented, she was literally hopeless. She has tried many modalities, including oral doxycyclines and oral tetracyclines. She has also tried metronidazole, and nothing has worked for her. And then we recommended a series of 6 sessions with the rosacea regimen, basically. So how I started off with this case, the first session was using the PR530 with the standard default setting with the split pulse. So it was 7 joules split into 2, so it's 3.5 joules per pulse. And afterwards, continuing further with her sessions, I performed also the treatment with the PR530, but I performed a double pass. The first pass was just the rosacea split pulse setting, and the second pass within the same session was the single pulse, short pulse duration, the 1.5 millisecond, and it ranged anywhere between 5 and 6 joules. And as an add-on, I recommended topical ivermectin to improve the overall result. And these results over here are shown after 6 sessions. The patient was extremely happy. Her family members were really, really happy. And even she comes to the clinic every 6 months for maintenance sessions, and still her face is clear. So we provided her with a short-term and a long-term, hopefully, results with the PR530. And the reason why I'm emphasizing on the importance of the submillisecond or the short pulse durations that not only that is very unique with the Nordlys and other devices don't have, is because when you touch her skin and it blanches, basically the short pulse duration will aim to target that and reduce the blotchiness, reduce the overall erythema and the inflammation, and provide her with an overall unified skin tone. So
that is an incredible case. Really, really life-changing. Congratulations, Hady.
Thank you. And this is what I mainly love about my job is us being clinicians and changing people's lives. That's what makes us really love our job.
Absolutely.
And I'm guessing we just have a question here, Hady. I'm assuming, and I could be wrong, was it 4 weeks between sessions?
Yes, at least 4 weeks in between sessions.
Okay.
So we're just gonna play a video showing the procedure.
Unbelievable. Thank you for sharing that.
Beautiful results obtained by this patient, and I'm so glad. And that's why the Nordlys is the all-time favorite device, because with all its modalities, the results are remarkable. And now moving on to the periorbital veins. It is one of the most popular procedures that I perform within my clinic. And as you can see, it is a hereditary condition, and a lot of the patients complaining from dark circles really don't know what is the contributing factor. There are several contributing factors like hyperpigmentation within the periorbital area. It could be a hollow tear trough, and definitely one of the major contributing factors is the presence of these under-eye vessels or the periorbital veins. So upon stretching the skin under the eyes, and because the skin is thin and translucent, patients would notice those spider veins or the periorbital veins under their eyes. And because it's translucent, it would give that violet discoloration, giving them that tired look and appearance. So for this case, she's a 35-year-old female who literally had this vein for as long as she remembers. We recommended a series of 2 sessions to optimally treat that periorbital vein. So the after that you see here was immediately after the first session, and you can see the erythema along with the vessel as we were tracing it. But the downtime is mild erythema that lasts a couple of hours and possible puffiness or a mild swelling that lasts a couple of days. And the nice thing about this is that that's an immediate results that was achieved with the NDX 1064. So right after the procedure, when the patient looked in the mirror and she remembered how she was absolutely amazed and astonished. She was very, very satisfied because this result was like night and day. And you can see a close-up image here, and you can see how mild that erythema is after the procedure.
Yeah, these are really wonderful cases of eye veins. I just want to take a second here to just also make sure that the audience understands the importance of eye protection when treating closer to the eye, and Candella's recommendation to use the intraocular shield. So very, very easy to place. We have some videos on our portal. If you have any questions, please contact the clinical team or your clinical trainer, and they can certainly get you that information. But this is a wonderful, wonderful treatment, but NDAG around the eyes, or any laser around the eyes, needs to be used with extreme caution with the appropriate eye care.
Thank you for adding that. I totally agree. And for that second patient, she's a 25-year-old female who works as a nurse, and ironically, she manages to sleep well regardless of her endless shifts. But she was always complaining of that tired look and appearance. She has tried under eye fillers. She has tried PRP. She has tried PRF. Many treatments that wouldn't actually achieve the desired result that she was expecting. So these results that you see were immediately after the second session. As you can see, mild erythema. Also, no puffiness was reported for the next day, and she was extremely happy with the results. And here's another close-up picture. Beautiful.
Those are beautiful, and you're absolutely right. I mean, many patients come with periorbital dark circles, but important to kind of understand what it is that's causing the dark circles. Is it vasculature? Is it pure pigmentation? It's usually a combination. So this is a great illustration of that.
Yes, and note that if it's a combination, I always recommend to start with treating the periorbital veins first, and then if she has quite a little bit of hollowness, then she would perform dermal fillers like tear trough filler under her eyes afterwards. And I totally recommend, based on my experience, this sequence of treatments. Moving on.
Hady, do you have a cross-polarized camera in your practice?
No.
Okay, your photos are great.
I think the lighting plays a huge role within the images. I do have, mostly I use my iPhone, although I have my professional camera set aside. I barely use it. I think with the iPhone, it's just way more convenient, especially if your waiting area is pretty full and you're really short in time. So you just pull out your iPhone and take those images. But I think lighting and before and afters are amazing, especially if the patient, because patients tend to forget how they look like, and to ensure that they know that it was really, really effective, it's good to see their befores in high quality.
These are beautiful.
So moving on, not only females have the skin concern of the periorbital veins. So this case is a male. He's a 30-year-old male also presenting with periorbital veins. Also, he was complaining of that tired look and appearance, and also have tried multiple modalities. And this is also another case. So this case actually She performed the first treatment, and then after 6 months, she came for her next treatment, and then she came for a follow-up. And honestly, I still see that patient for other procedures, and I still always stretch her under eyes to see if she would require a touch-up, or if the result is still, pretty prominent. And after 3 years from coming, so far, her periorbital veins did not come back. So I think this is a great procedure on the short and the long term.
Really beautiful, and the audience feels the same. You're getting fan mail. So
Thank you so much. It's always a pleasure, and it's always a pleasure because this is one of my all-time favorite devices, and I think it's a one-stop shop. It literally has all the modalities that someone can think of, especially with all these indications. You also have hair removal within that system. So for aesthetic purposes, whoever comes into your practice and wants to have a hair-free body or hair-free underarm, or just suffering from hirsutism around their face due to PCOS or any genetic component, within the same device, you can actually treat that. So for example, with the first patient, he's a 34-year-old male. He was just getting ready for next summer. He wanted to have a hair-free back. It was actually a skin concern to him. And the results that you see here were 3 months after the fourth treatment. I was very surprised because after the fourth treatment, I booked him in after 6 weeks and he didn't show up. And then he messaged the clinic and he was like, you know what? I still don't see any hairs. And I really think it's very comparable to the gold standard hair removal devices out there with its effectiveness. I've had about 9-year experience with the HR and the HRL 600. And I do see amazing improvement with the hair removal. So for that case, he just requires 1 or 2 sessions per year just to maintain that hair-free result. And here's a close-up.
And a question
picture
for you here.
Sure.
This is wonderful. What's your endpoint on a skin type like this? What is it that you're looking for when you do it?
So a clinical endpoint would definitely be a little bit of erythema, perifollicular edema as well. Whenever I see the perifollicular edema, I get really, really excited. I know that the patient is going to respond. The perifollicular edema will subside within an hour or two. The erythema would subside within 24 hours. And then the patient would expect that the first week the hairs will grow. And then upon week number 2, the hairs will start falling off. 3rd week, 4th week, until the 6th week, the patient is completely hair-free. And what I love about this handpiece is that the crystal, you can see literally all the angles around it. So the possibility of you missing an area is extremely low because you can literally see what you're targeting. Unlike other devices with just the motion technology, patients would end up with a lot of patches thinking that this should be the result, but it's actually not. It doesn't look aesthetically appealing to have patches. But with the HR and how the handpiece was made and how it's designed, I think most patients are really, really happy because after just the first session, they're completely hair-free. Of course, on the short term, they have to proceed with their sessions, but it's just from the first session, they are convinced that this is the right device for me. So I totally believe with the HR, and I personally used it on myself to define my beard, and I think it's amazing.
We do have a question from Allie.
Yeah.
Oh, I'm sorry, Dr. Schallen. How long do you wait between sessions for the back, I believe is the question. Yeah, that was the question.
So it's about 6 weeks for anything on the upper body. Lower body, I wait about 8 weeks. And anything on the face, I would wait 4 weeks. But then definitely that doesn't apply to all patients because everyone is different and everyone responds differently. So if, let's say we got to the 4th or the 5th session and the patient came after 6 weeks for his back, and I literally don't see any hairs, I would not perform the procedure. I would wait a week or two to respect the hair cycle. And then once I see a little bit of stranded hairs here and there, I can see closely the hair growth, I would perform the hair removal. So it's not one, it's not 6 weeks for everyone. It's not 4 weeks for everyone. I would start off this way, and then I tell the patient that to work hand in hand, and I want him to monitor how the hair grows, and then we can go from there.
Thank you.
Okay. Moving on. So this is a 31-year-old male, fits type 4, who presented with excessive hair on his legs, and he just wanted to have the hair-free appearance. So we also performed that treatment with the HRL 600. Note that there are 2 handpieces for the 3 handpieces for the HR. There's the HR 600, which is a smaller spot size than the HRL 600. And I think this is really an advantage because I get to finish the full back within 15 minutes, 10 to 15 minutes with the HRL. So that also, from a business perspective, you get to do more patients a day, and the patients don't get to wait, an hour or 2 to finish a certain area, which I think it's great. So anyway, going back to that patient, we performed 6 sessions, and then this patient came after the summer, so 5 months after the 6th treatment, and literally he had stranded hairs here and there, but he just wanted to have that hair, completely hair-free appearance. So we performed a maintenance session. So as you can see up close, beautiful results and nice smooth skin.
Hady, can you comment a little bit about the intensity of the endpoint on that patient? It looks a little bit darker. What do you see in terms of, how do you gauge the difference in intensity from lighter skin patients to darker Fitzpatrick skin type patients?
So for example, going back to that previous patient, the average fluence that we performed was around 13.2. He's a Fitz type 3. And within the endpoint, basically, I want to see some quite a little bit of erythema, quite a little bit of perifollicular edema. But for that case, going forward, he's a little bit of a darker skin type. We still use the HRL 600, but that patient, we performed the test shot to begin with the HRL 600, and it was about 11 to 12 joules, and the patient seemed to respond pretty well. We did also see some erythema. We also saw perifollicular edema, but there was no reported excessive burning sensation that lasted more than 5 minutes or 10 minutes, because this is where I get a little bit alarmed when patients tell me, oh my God, like after half an hour or an hour, they tell me I still feel the burning sensation. So for that patient, the test shot went well, and then I went from there. With the fluence, I did not go really high with the HRL 600, just in order to keep it within the safe parameters. And also emphasizing on the importance of the selective waveband technology, because nothing is exceeding 950 nanometers, and also there's that water filtration. There's no need for cooling because you're not causing bulk heating. Thus, the risk of burns, hyperpigmentation, and hyperpigmentation are slim compared to other devices.
And I'm assuming you are doing, is this a single pass session, correct?
Yes, that's correct. A single pass over the whole area.
Mm-hmm.
Okay. Moving on. So I think having the hair removal within the Nordlys is a great add-on. It's just not only for aesthetic purposes, but also for patients presenting with folliculitis and ingrowns. That could be a great treatment for ingrowns. For example, this patient and the next patient, they both were complaining of the ingrowns that they would get, especially after shaving, um, and defining their beard, which is not very aesthetically appealing. Um, as you can see, they got the perfectly defined beard. And also, when I mentioned in regards to the crystal of the handpiece, you can clearly see the angles and you can maneuver your head and see around it to see if you're actually targeting the area of that the patient wants to treat. So if you're treating delicate areas like the beard, you really don't want to cause any patchiness and accidentally target a little bit of his beard. You don't want him to end up with a patch. So I do not use anything to isolate the beard. I don't use a tongue depressor. I don't use a gauze. It's just how the applicator was made. And you can literally see all the borders and the corners help me achieve such a nice and defined beard.
And there's a question about overlap. When you're doing hair removal treatments, how much do you like to overlap, if at all?
No more than 10%. So
thank you.
Overlapping more than 10% doesn't have any additional benefit, but you're targeting the same area twice. But if you don't overlap at all, you may leave some patches as well. You may leave some untreated areas. So I tend to overlap by 10% in order to prevent all of that.
And in subsequent sessions, later sessions, when you have some patches of hair, do you treat in fourth, fifth sessions the entire area, or are you treating only in patches? That's one of the questions as well.
I would say it depends on the case. So if it's a large area and it's only patchy, for example, I would only treat the patches. But if it's the beard and the hairs are just significantly thinner and they're spread out over the whole area, then it wouldn't make sense to treat just the hairs. I would just treat the whole area.
And one last question. There is a question from the audience. Tell us why you chose the HRL 600 for your skin type 4 as opposed to the HRD applicator.
That's a good question. For the skin type HRL 600, you can do it anywhere from skin type 1 to skin type 4 safely. Of course, with caution when it comes to skin type 4, and that's why I did the test shot. But typically, the HRD is optimal when it comes to skin type 5 and 6. And that definitely, I would not use the HRL or the HR 600 for skin types 5 and 6. But the HRD is not really optimal for anywhere between skin types 1 and 4.
And thanks for that feedback. And 4 is such a difficult question too, right? Because it's your interpretation of the skin type, which may or may not be. It's very important that it's not just the patient's, what you're looking at in front of you, but it's the patient's response to the sun. So it's about ensuring the proper selection of skin types. You certainly are safer to go down, and so it's not. It's never a bad thing to start more conservatively. I'm just saying to the audience who has these, if you have these questions, start conservatively. Hady mentioned test spots, which is really the key. And darker skin patients should have test spots, and you can even send the patient home and have them come back a week later to make sure that there's no hyperpigmentation, because sometimes it's not evidence immediately. So I just want to make sure and emphasize that for some of the audience that has some questions about those middle skin types, 3s, 4s, that the answer is not always completely clear or textbook, cookie cutter.
I completely agree. Test shot and sending them home for a week just in order to ensure this, to achieve the safety profile of this procedure, because God forbid you went a little bit higher, and then with the test shot you saw a little bit of hyperpigmentation or burns. It's better to do it on a very small area rather than the full legs, for example. This would give you definitely a peace of mind doing the procedure afterwards. And also one thing I wanted to mention is that ethnic backgrounds play a huge role in determining the skin type. So someone might look a little bit lighter, but they're definitely more photosensitive or more sensitive to the laser treatments than someone who looks a little bit darker with a different ethnic background. So that's when, if you're in doubt, perform a test shot and then go from there.
Great point.
Okay, moving on. And here's another case as well, as I mentioned. For this case, he performed 4 treatments, and then the results that you see is 6 weeks after the 4th treatment. He was definitely complaining of the folliculitis within his lower neck, which he found it hard to wear certain clothing that basically would hide the neck. It just makes it a little bit uncomfortable. So definitely this procedure was a great investment for him. And here's a close-up picture. And you can see, unlike other devices with that motion technology, it's not patchy at all. So, and the reason why, to finalize this from my end, the reason why I love the Nordlys is that it has all the timeless technologies. As Meghan mentioned, it has the Selective Waveband Technology, IPL, which is very unique within the Nordlys. It can treat some resistant cases, especially when we're talking about the flushing and the blushing accompanied with rosacea. It has 2 non-ablative fractional lasers, the 1550 for deep resurfacing and collagen induction, and the 1940 for benign pigmented lesions. It also has the long pulse ND-ACT 1064 for vascularity, warts, and onychomycosis. It is the only system with the Selective Waveband technology for added skin protection, so that brings me the peace of mind of not putting my patients at risk. It is the only system with 2 non-ablative fractional laser handpieces, the 1550 and the 1940. It has all the diverse applications. It has 22 FDA-approved indications, and it can treat up to skin type 6, of course, depending on the applicator. It is quiet, so you can enjoy those lovely conversations with your patients as you're treating them. And it is ergonomic, so if you'd like to move it around within your clinic, it is so easy to do so. It has guided treatments for short learning curves. So from the audience, for all those busy doctors and the entrepreneurs, you can definitely delegate it to your technicians. It has a short learning curve, and it is very user-friendly.
Hady, you've been so great with your transparency. So I just wanted to ask you, as a provider, because this is something that's a little bit, I know, tricky for me or other practices that I've worked at. When you were evaluating the technology, after you decided to purchase the system, did you pre-market the system at all? How did you recruit patients for it? And how did you pick the technology based off of the needs of your practice?
So I've been working with the Nordlys for about 8 years now. And I previously, before the Nordlys, I started off with Ellipse, so I'm very familiar with the technology. But of course, I have tried also other modalities. And once I got into the technology of the Nordlys, I found it really, really unique. To start off with, I wanted a device that literally does everything. And as I mentioned, I wanted a one-stop shop within just one device. So after doing a lot of research, I made up my decision that the Nordlys is the one, because it can basically treat vascularity, it can basically treat melanin, hair removal, leg veins, spider veins. So most indications that I might encounter in my clinic, I can mostly treat them with the Nordlys. I really wanted a device that can function similar to 3 other devices out there in the market, all within one device. So after a lot of research, I decided that Nordlys is the one.
And just as a side note to what Hady's speaking of, I had a patient who had undergone 3 sessions of broadband intense pulse light device, and she actually stopped going to the original practice that had sold that to her because she had rosacea and she felt as though she did not see any endpoint at all. And so when she came to see me and I treated her with the Nordlys, I was like, look, I believe in this technology twofold. I love this, but I do need you to be transparent. If you do feel as though you don't get the result, I will work with you to make sure that, you know, you're satisfied. And after 1 treatment, she texted me and said, I wish I could get this device done every month. I'm obsessed with the results. It's unbelievable how much better it is compared to the 3 sessions she had with the broadband IPL. So I know for me as a provider, it's really important for me because I consider my patients friends. And so I want to make sure that I'm able to deliver what I say I can deliver. And I never even question if I'm going to be able to do that with the Nordlys. So I think that's really important. Whereas in other practices where I've worked, if they didn't have a Nordlys, really any other IPL on the market, in my opinion, when I go to use it, I'm very nervous about selling it to someone because I don't really fully believe in its abilities the way that I do with Nordlys. So I think that's really important. And as you can see with Hady, I'm guessing it looks like you've been very successful with your marketing based off your befores and afters. So I'm guessing that's kind of how you've been able to create your patient clientele, right? Just consistent befores and afters and posting those as much as possible.
I definitely agree, and we're both on the same page. The key is to deliver results and show patients organic results. Something I like about the Candela slogan is sign, trust, results. And that's what the patients out there want to see. They want to see a skin that, or a condition that is very similar to theirs, and they want to come here with confidence. And they want to start the treatment right away because they've been seeing organic content all the time. And I want to say I'm really confident with the Nordlys. Whenever I tell a patient there's a high chance of success, I'm pretty confident that with the Nordlys I can achieve this. And the best part about my job is that when she sees it and it's life-changing for her, this actually makes me really happy to come to work the next day, you know? So I'm really confident with this system and with all the results that it has achieved so far with all its handpieces, starting with the HR and the VL and the PR and both non-ablative fractional laser handpieces. It's just this didn't disappoint me with any modality. And this is why I think with the Nordlys, it is my all-time favorite device, and I mean it.
And Dr. Schallen, I think with your practice, you agree, right? Because from our discussions, you use this quite frequently.
Yeah, it's the first device that I would go to, or the first device or only device that I would, if I had to choose one, that would be the one. So I agree with Hady, and I agree with you, and definitely want to thank you both for all your very open sharing of your cases. And Hady, you've got such extensive experience with this technology going back to the Ellipse days. It really is special, and so thank you for giving your expertise to the Candela community out there. And Meghan, as always, thank you for all of your wonderful teaching and really down-to-earth way of explaining things. It's fantastic.
Thank you, Dr. Schallen.
I just want to let the audience know that if you've been on the webinar for at least 50 minutes, please do click on the icon on the bottom to download your certificate of attendance. Please allow us about 24 hours to get that back to you. And on behalf of the team at Candela, would love to thank you for your participation in this meeting. Thank you so much for joining us. We hope that it's been helpful for you. Please, once the meeting ends, do take the post-event survey. It helps us plan future meetings and make sure that we're doing the right job for you. And with that, this concludes tonight's program. We hope you have a great rest of your evening. Thank you.